All right, well, this morning I have the privilege to introduce Maxie Davie. Maxie is one of our 8th-year residents, and for the students who don't know, all of our residents are required to present a grand rounds as part of their educational program and training, and Maxie is presenting on a very important topic today about vaccine hesitancy and the anti-vaccine movement. And I will tell you, this is not a trivial topic. We are seeing more and more parents who are resistant to vaccinating their children. And on the positive side, on the medical side, we have more and more vaccines in development. And parents want to pick and choose, which is their prerogative, but at the same time, many of these vaccines have important public health implications. Just as an example, the measles outbreak in California associated with Disneyland a few years ago, the estimated costs to the state were over $10 million in expenditures in the investigation, tracking, and health care for those children who were affected by that epidemic. And of course, we as taxpayers are on the hook for that money, and we have to be judicious about how we spend our money. So, and in other parts of the world, like Oklahoma, the state AAP, Academy of Pediatrics president, has had to engage in a lawsuit against anti-vaxxers because they were harassing her so much at her practice, online, and at her home. And so this is, like I said, not a trivial issue, and it's a problematic one. It's one we have to be ready to deal with because, you know, protesters may show up in the back booth any minute now just because they heard that Maxie was talking about vaccines. So pay attention, learn some lessons, and try not to laugh too hard at some of the pictures.
Thank you so much, Dr. Venturi. All right, so I'm talking about anti-vax, something that we've seen a lot in clinic kind of more recently, so I just kind of wanted to dive into it. So, of course, I have no disclosures. Our objectives today, I'm going to start with a brief history of vaccines. I think it's a good place to start to kind of know where we came from. I will then discuss kind of the change in parental acceptance and kind of the history of anti-vaxxers. And then we'll move into identify ways to address vaccine hesitant parents. So outline, we'll start with the discussion of the history. I will review some of the diseases eradicated by vaccines, discuss the history of anti-vaxxers, identify the most common reasons why parents refuse to vaccinate their children, and then, of course, end with describing methods you can use to help your anti-vax or vaccine-hesitant patients to kind of get them vaccinated. So let's start with the history. So does anybody have any idea who this guy is here? So this is Edward Jenner. He's kind of the man who started vaccines for us. So he was walking around a small town over in Europe, and he overheard this milkmaid say, "I shall never have smallpox, for I have had cowpox. I shall never have an ugly, pock-marked face." And as any good scientist would think, he heard this and thought, there has to be something to this. Maybe there's something going on with these milkmaids that are preventing them from getting smallpox. So the first vaccine was created in 1796. This man, Edward Jenner, he went and he actually took some of the pus from a cowpox on a milkmaid's arm, and he inoculated a young boy with it. Now, I don't know whose mom would allow them to have this done, but apparently this child got inoculated with the pus. After that, he went ahead, and 6 weeks later, he injected the smallpox, actual smallpox, into the arm of this child, and he found the child never developed smallpox. So after this, he went ahead and he did it to a few other people, and he realized that none of these people were developing smallpox. So he published a book called Inquiry into Cause and Effect of Vaccines, and that was where he got the first vaccine. He became the foundation of modern vaccinology, and he's who we have to thank for everything. So I just wanted to give you all a brief timeline of all the vaccines and where we've come from. Before I started this, I did not realize that vaccines started so long ago. I thought they were more of in the last, maybe 60 years we really got vaccines, which a lot of them did come. The first live attenuated bacterial vaccine actually was in 1879, and that was our chicken cholera right here. And then the first live attenuated viral vaccine was in 1884, and that was the rabies here. So just a good outline of all the vaccines and what time they came. thought this was kind of funny. So let's move into the eradication. So smallpox is actually the only disease that's fully been eradicated because of vaccines, and that was declared in 1980. Polio is close. In 2016, there was only 37 cases reported. This one always makes me laugh. So disappearance of disease in the U.S. So polio disappeared in the U.S. in 1979, followed by smallpox in 1980. We still have not seen either cases of these. Measles was declared gone in 2000, which we now know is present. Rubella in 2004, and again, we know those are now back, unfortunately.
But they're not back as endemic. They get imported.
Exactly, they get imported. They're not, yes, exactly. So now we're going to move into the age of anti-vaxxers. So this at the top says, don't vaccinate, vaccines kill. I hope y'all all know this, Jenny McCarthy. She was a big anti-vaxxer, so I found that kind of funny with her cigarette. So the history of anti-vaxxers, this was something else that surprised me. Anti-vaxxers actually started a long time ago. So in 1840, the United Kingdom basically decided we need to make the smallpox vaccine free because we want to get everybody vaccinated. If we make it free, more people are more likely to become vaccinated. So in 1840, the United Kingdom Vaccination Act came out and made vaccines free. In 1853, they came out and said any child 3 months and younger is required to be vaccinated. If you do not vaccinate them, you will either be fined or put in prison because of it. So this, of course, led to our first group of anti-vaxxers in 1867. It's the Anti-Compulsory Vaccine League, and their point was the government cannot tell us what to do, and it's not the government's job to tell us how to take care of our children. So they did like any other big group does. They started putting out these articles, started doing riots and grabbing people and trying to pull them in and tell them what not to do. So we have in 1898, the act was then amended because of all this that was going on to allow for conscious objectors. This basically really was to allow people to kind of get out of the smallpox vaccine and allow it so that they did not have to vaccinate. So one of their journals I wanted to show, this is a picture of one of the top of the journals, and I'm just going to read you a portion of it. It says, a mighty and horrible monster with the horns of a bull, the hind of a horse, the jaws of a kraken, the teeth and claws of a tiger, the tail of a cow, and the evil of Pandora's box in his belly, plague, pestilence, leprosy, purple blotches, and filthy running sores covering his body, and an atmosphere of accumulated disease, pain, and death around him, has made his appearance in the world and devours mankind, especially the poor, helpless infants, not by sores only, but by hundreds of thousands of people. So kind of interesting, but it's just something that they put out to kind of scare people and to kind of convince them you should not be vaccinating your children, it's a bad thing to do, which kind of is terrifying. And if you're not well educated and you hear all this stuff, it would be something I can imagine that would kind of scare you. So now in the United States, in the 19th century, smallpox was actually going away. We had a great vaccination rate and the incidence was falling. So of course, vaccination rates started to fall. In 1870, we had a new outbreak of smallpox vaccine, and so the United States wanted to pass a law that made it mandatory for everybody to start getting vaccinated. Well, our lovely UK group overheard this was going on somehow, and the Anti-Compulsory Vaccine League made their way over to the United States. So in 1882, we now have the New England Anti-Compensatory Vaccine League. In 1885, we have Anti-Compensatory Vaccination Leagues of New York. So this UK group came over and actually got 2 different areas of the United States to start their own anti-vaccination league. They brought lots of lawsuits against the United States, and of course the United States never did be able to pass their law to make vaccination mandatory. So moving on, why do parents choose not to vaccinate their children? This is really funny. So what are the statistics? So in 2010, there was a national telephone study that was done. It was of 1,500 parents, so 46% response rate. Of the people that responded, 3% of all respondents refused all vaccines. 19.4% refused or delayed at least one recommended vaccine. In 2006, the AAP decided to do a survey of actual pediatricians kind of to determine how many pediatricians are interacting with parents who are against vaccines. 75% had encountered a parent who refused to vaccinate. In 2016, they did a follow-up study, and at that time, 87% had encountered parents to refuse to vaccinate. I mean, only being here for 2.5 years so far, I have met at least 5 or 6 parents who refuse to vaccinate, which is pretty crazy to me. So why were parents refusing? The 2 most common reasons were vaccines they felt were unnecessary, or there was a concern about autism. The good thing, though, is the concern about autism did decrease between the 2 studies from 2006 to 2016, but it still was one of the main reasons why parents refused to vaccinate. So in 2009, we have a health style survey. This was a study done by Kennedy et al. To parents about their concerns of vaccines. It had a 65% response rate, 60% were female, 59% were white, 63% had a college education or higher. They found they were looking at a number of vaccines that they felt comfortable giving at one time, with most filling 1 to 2, followed by 3 to 4. 72% were comfortable or very comfortable with the number of vaccines that their child gets, whereas 21.9% were somewhat or strongly agreed that vaccines that were given were too many. So the WHO kind of led on to this group and kind of wanted to figure out, what do we call these people that don't want to vaccinate? So they came up with the word vaccine hesitancy. So the WHO defines as behavior influenced by 3 things. So confidence, that they do not trust the vaccine or the provider. Compliancy, they do not perceive a need for a vaccine or do not value the vaccine. And third is convenience, so access. So there's 3 groups that they list under who are vaccine hesitant. The first group may accept all vaccines but still have concerns about them. The second may refuse or delay some but accept others. And the last may refuse all. This last group actually encompasses 3% of parents, which I thought was actually a large group of people. So back to our 2009 health style survey. So they're asked to respond about potential vaccine-related concerns that they had. 20.8% reported that nothing concerned them. The most common, of course, was pain. Too many vaccines concern parents, 34% of them. Fevers, 28%. Too many before the age of 2 is 27%. And vaccines causing autism or other learning disorders, 26%, which I actually thought was a huge percentage. Of course, this was 2009, but still a big percentage really felt that autism or learning problems was a big concern to them. So this I thought was a good kind of overview of how vaccines kind of come about and how they rise and fall in our community. So if we look about, this is the pre-vaccine era, here's disease rate right here. So as disease rates are high, you're wanting to get rid of them, so this vaccine comes out. So vaccination rates go high because, of course, parents don't want their child to get the disease. So disease rates fall. So then we get to this point to where disease rates are pretty low and vaccination rates kind of steady off. Then you get to the point where your vaccination falls, so you get these outbreaks. So then vaccines increase again, your numbers fall, and then hopefully we get to the point of eradication. But this is just kind of a way that you can think about any area when your disease rates start falling, vaccination rates start falling, parents don't think they need the vaccine, so that's where we start getting outbreaks again. So measuring vaccine hesitancy. So the WHO has a group called SAGE, Strategic Advisory Group on Experts, and they basically felt they wanted to figure out what is a good way to kind of determine how to figure out who doesn't vaccinate, who does not vaccinate, and why do they not want to vaccinate. So 2004, UNICEF has a group called Joint Reporting Forum, looked for areas where there was negative media coverage of vaccines. So no surprise, they found the highest areas was in the United States and Europe that had media that had negative connotations of vaccines and why vaccines were bad. In 2013, this JRF sent a survey to various countries that they served. They asked 2 questions. First of all, what do you feel your parents don't want to vaccinate? And 2, has anybody ever looked at this thought before? So they had about a 69% response rate from the countries that they served. The top 3 reasons why they did not want to vaccinate were beliefs and attitudes and motivations about vaccines, health and prevention, that they didn't think they needed it, and the third was communication and the media. So the media environment really influenced them as to why they would or not want vaccines. And SAGE determined after looking at all the stuff that they needed a survey that was validated, a validated tool on how to figure out who doesn't want to vaccinate. And by finding out who does not want to vaccinate, maybe we can find ways to help them to convince them to vaccinate their children. So how do we address parents who are vaccine hesitant? I thought this was funny because I see this all the time on like anti-vaxxers websites, but it was a good way to kind of go back at them because of it. No, this is funny. Have you ever had polio? Neither have I, thanks to vaccines. So the Journal of Pediatrics kind of wanted to let's figure out a way to kind of help pediatricians learn how to help their vaccine-hesitant parents. So in 2016, this was published on why parents don't vaccinate and how to help persuade vaccine-hesitant parents in your practice. So the first thing they talked about was pain, which is really the most common reason why parents don't want to vaccinate. So they talked about administering vaccines quickly without aspirating, holding the child upright. Sometimes you can give more anxiety to the child by holding them down. Administering the most painful vaccines last to kind of get the easy ones over first and then giving the most painful ones last. Provide tactile stimulation or something that they can play with and kind of alter their sense of what's going on. And breastfeeding is actually a big thing. I actually know parents who actually breastfeed during their vaccines, and they have decreased, anxiety with their child. Their child doesn't seem to be as afraid of it, and they aren't screaming. You can also do the sweet tasting solutions like we do for LPs on kids and topical anesthetics. They also talk about distraction toys like pinwheels. You can do deep breathing exercises. Most of this you can thank probably from our child life specialists who do this. All the information about this actually came from all the research on painful procedures like LPs, and it was just extrapolated to encompass vaccines. It's not really been studied for vaccines, but I think it's a great thing we can do. So the next is poisons in vaccines. I know a lot of people hear about this. So the first one's mercury. So actually none of the single vial vaccine doses have mercury in them. So if parents are really concerned about it, you can offer all the single vaccines. The next is aluminum. So aluminum is actually needed to get your immune response, and that's why it's in there. And there's no studies that's shown any toxicity. There's really a lack of evidence for that. For some parents who don't really believe a lot of the research, it may be hard, but it's always something you can tell parents if they've heard that. And then the most important one, which I just learned about this recently, was the idea of aborted human fetuses. So vaccines do not contain these cells, and earlier use of fetal cell lines in vaccine production does not prohibit the use. The Pope actually came out and endorsed vaccines, and even though he knew about this, he said vaccines are important, and just educate your parents that none of the current vaccines have those cells in them, so you're not going to be injecting any aborted fetus cells into the child. So this is one of my favorite ones. So this is too many vaccines. This is from Offit et al. Put this together. This is basically parents who say, you're giving so many vaccines at one time, are you giving them too much for their body to fight off? Is there too much in that vaccine at one time? So this is back in the 1900s. So this shows smallpox, and there was about 200 proteins in one vaccine. In the 1960s, you gave about 3,000 total proteins. 1980s, we gave about 3,000. Now today, this is in 2000, this is the number of vaccines we're giving. And look, you only have about 120 proteins you're injecting. Also important to remember is that the number of proteins you're injecting is way less than any kind of bug or virus or things that kids are getting into. So you can really tell your parents, if you were vaccinated in the 80s, you got way more than your child did, and the autism rates are still going up, but there's no reason to assume that this is the cause when it came to proteins that you're injecting. So autism is one of the favorite ones. So we all know Andrew Wakefield. So in 1998, he published a study in The Lancet correlating MMR to autism. The study was actually retracted in 2010, and the reason was taken because they found multiple flaws in his study. He only had 12 patients in his study, and it found that he was actually funded by lawyers of anti-vax parents in the UK to do this study. So that's why it got retracted. He now thankfully does not have his medical license anymore. So why should this all concern us? So why are we really concerned about parents who don't vaccinate? So there's a paper published, it was a review of measles and pertussis. It was a study published in 2016, and it was a literature review to evaluate the association between vaccine delay, refusal, or exemption and an epidemiology of measles and pertussis. So they reviewed 18 cases on measles, about 1,400 cases. 56% had no history of vaccination rate, and of the children not vaccinated, 70% of them had non-medical exemptions. And they did 32 studies on pertussis, 10,000 cases, and the range was 24 to 45% were unvaccinated or undervaccinated. So in the measles review, one study they found children with exemptions were 22 times more likely to contract measles than the vaccinated child. A study done by Salmon found that children were 35 times more likely to contract measles than the unvaccinated child. and found that exemptions were more likely to be the index case in first generation compared with later generations. And what this means is that they did studies looking at who was the first person to bring the measles over and then where did it spread to. So the index case, of course, is the first person. First generation is that next level group of people who got it, and then further generations on. So the people with the exemptions were more likely to be that index case over that first generation that ended up with the measles. So pertussis review, so Colorado study found that with exemptions were 5 times more likely to acquire pertussis compared with fully vaccinated children, and glands found a 20-fold increase in risk of unvaccinated compared to vaccinated children. So there really is a huge risk if you don't vaccinate your kids. This is a very cool website called vaccineswork.org. They publish it about every month, and you can look and see where there's outbreaks across the world. So I just narrowed in on the United States, Mexico, and Canada. But as you can tell, there's mumps, lots of mumps going on, whooping cough. This is from September. So this is where you're having these huge outbreaks right now. So it may be good for parents, if they don't, if their kids have not been fully vaccinated or they're concerned about things, you can definitely pull up this map and show them where the huge outbreaks are right now. And it even shows you international, so any families that are wanting to travel anywhere, it's kind of a good place to look up for that information. So what methods work for parents? So this first study was a little interesting. So effective messages and vaccine promotion was a randomized trial done by NIHAN. And it was a survey of parents across the nation. Now, it was all online. So he basically got parents and he put them into 5 different groups. He did textual information on MMR and autism. So just what is the different MMR and what is autism. Textual information on the dangers of the MMR disease. Visual images of children with MMR diseases. Audio narrative about infants who almost died on measles. And then no intervention at all. So what they found is that no intervention increased parental intent to vaccinate a future child, and concluded that public health communications may increase misperceptions in parents or reduce vaccination intentions. Now, the limitations of this, again, were it was all online, so there was no interaction between the actual parent and their pediatrician. But it kind of showed that giving all this negative connotation to the vaccines and the diseases may not help as much as some people may think. So what is the good news? So Edwards et al. Found that pediatricians were able to convince approximately 30% of parents to vaccinate who initially refused, which is a huge percent. Opal et al. Found that when physicians continue to engage parents, up to 47% ultimately accept their vaccines. And Kennedy et al. Found that 80% of parents' decision to vaccinate was due to a positive experience with their pediatrician. I think this really shows that you are the ones who can really convince your parents. A lot of people out there are really scared of them, but they get information from the wrong sources. So I think if they trust you as their doctor and you're able to talk to them, a lot of them actually will go ahead and vaccinate their child. So the last thing I wanted to talk about was dismissal of patients. So a lot of clinics right now are discussing, should we have children who do not vaccinate into our clinic? There's actually no data regarding the eventual outcome of this, according to Edwards et al. Of course, what they say is you want to assure there's adequate providers in their city. If you're the only pediatrician in a 50-mile radius, it's going to be really hard for you not to accept them if they have nowhere else to go. You always want to follow the laws for your area. You don't want to run the risk of being in an abandonment lawsuit because you abandoned your patient. I actually have lots of friends who are currently in pediatric groups that they don't accept any unvaccinated kids at all, which I think is a big deal. And there's also some pediatric groups out there that are giving certain time periods for parents if they want to come. So maybe Tuesdays and Thursdays from 1 to 3, if you don't want to vaccinate, you can come then, but you can't come any other time. And that hopefully will help decrease the rates of having any problems. So 2 things I wanted to show you guys. So the first one was this. I don't know if y'all have ever seen this, but this is the anti-vaccine body count. It was done after Jenny McCarthy started her whole anti-vaccine thing. And of course it was only to 2015, but it shows 9,000 deaths, preventable deaths from if people vaccinated, and number of autism diagnoses linked to vaccines was 0. So I thought that was kind of funny. And the last thing I want to do was show this video. This I really like this because it's actually somebody famous who's promoting vaccines. So it's just a 5-minute quick video.
There's another
really
area in which I feel like we're headed in the wrong direction. I want to get serious for a minute if I could, because I've been hearing a lot of talk lately, and I don't know if this is more prevalent in LA than other places, but I feel like it probably is, but there's a small but still sizable group of people who are choosing not to vaccinate their children. Here in LA, there are schools in which 20% of the students aren't vaccinated because parents here are more scared of gluten than they are of smallpox. And as a result, we now have measles again. We've got measles. I want to say something about that. I know if you're one of these anti-vaccine people, you probably aren't going to take medical advice from talk show hosts, and I don't expect you to. I wouldn't either. But I would expect you to take medical advice from almost every doctor in the world. See, the thing about doctors is they didn't learn about the human body from their friend's Facebook page. They went to medical school where they studied all sorts of amazing things, like how to magically prevent children from contracting horrible diseases by giving them a little shot. You know those little shots of Botox? Which is botulism, by the way. You get in your face to make your head look smooth and your eyes look crazy. A little shot like that and poof, polio is gone. But some people do not buy into that because they did a Google search and Jenny McCarthy popped up and she had clothes on, so they listened to what she had to say and decided not to vaccinate their kids. Now, and by the way, I want to say, this would all be okay if your kids were the only ones affected. They're your kids, but they're not, because unvaccinated kids put all children in danger, especially babies who are too young to get the vaccination shot. But of course, that's according to doctors, so, you know, take that with a grain of salt. Now, some people are saying kids who aren't vaccinated shouldn't be allowed to go to school or daycare or go to public places, but here's how I think it should go. If you are one of those people who knows more than doctors, that's fine, no vaccinations, but you're not allowed to go to the doctor anymore. Okay? Why would you even want to go to a doctor who knows less than you do? So, if you fall and you cut your head open, you will not be admitted to the emergency room. Stay at home, find that sewing kit you stole from the Marriott, and stitch it up yourself, Doc. And the doctor will see you never. Oh, by the way, you should also let your kids smoke. Why wouldn't you? The only people who say not to are doctors, and they don't know. So I feel like this is starting to snowball. So we invited some real doctors to address this. Again, these are not actors. These are actual medical professionals. Every one of them is a real doctor. So hear them out and then decide for yourself.
I am a doctor.
I'm a doctor.
I'm a doctor.
I'm a doctor.
And I believe in vaccinations.
And I believe in vaccinations.
If you don't vaccinate your kids, it can endanger their lives.
The potential downsides of vaccinations are almost non-existent.
The cumulative scientific and medical communities are in absolute full agreement
That there is basically no reason not to vaccinate your kids.
No reason.
Which is why I cannot believe we have to make this PSA.
I thought we settled this in the 50s.
Hey, remember that time you got polio? No, you don't, because your parents got you vaccinated.
I did 4 years of undergrad, 4 years of medical school.
And 3 years of pediatric residency.
I had to go to school for 8 years.
I'm pretty sure I know what I'm talking about.
But you people still won't listen.
Now I have to use my only day off to talk to you idiots about vaccines?
I want to finish watching Breaking Bad.
I'm only halfway through the second season.
But instead, I've got to come here.
Because you listened to some moron who read a forwarded email.
Perfect.
All these people had to set up cameras, lights, sound equipment, so that I could tell you to do something we've been doing for a century. Look at all these people.
This is stupid.
Get your kids vaccinated.
Get your kids vaccinated.
Get your kids vaccinated.
Get your kids vaccinated or lose my number.
Get your kids vaccinated, or these doctors may never find out that Walt dies at the end of Breaking Bad.
Are you kidding me, dude?
Paid for by professionals who know what the hell they're talking about.
Thank you, doctors.
I thought that was really good because it's one person who actually is for vaccines. So I hope y'all learned something a little bit. Those are all my references. Thank you so much.
So any questions, comments? I'll actually start because I have one of these quotes that I particularly like. This is from Ben Franklin. Have you seen this quote?
I don't know.
Benjamin Franklin, everybody knows who Benjamin Franklin is? So in his autobiography, he wrote about the death of one of his sons. He says, in 1736, I lost one of my sons, a fine boy of 4 years old, by the smallpox, taken in the common way. I long regretted bitterly, and still regret, that I had not given it to him by inoculation, vaccines. This I mention for the sake of parents who omit that operation, on the supposition that they should never forgive themselves if a child died under it. My example showing that the regret may be the same either way, and that therefore the safer should be chosen. And you're talking about, this is in the 1730s, when he had the opportunity but didn't vaccinate his child. Some of the known risk factors for non-vaccination are, going to college, like Jimmy Kimmel says, being smarter than doctors. We know that the homeschool population there are some families who choose to homeschool to avoid vaccination requirements of going to school.
Most of them are gluten-free too.
Can't speak to that. Interestingly, in Louisiana, the recent data on just looking specifically at meningococcal vaccine at 13, 14 years of age, and the number of kids who have not received it. In the kids who go to school, go to public or private schools, 96% of the kids in Louisiana, there were about 600 kids who had not received meningococcal vaccine as recommended. When you add to that the number of kids who homeschool and had not received vaccines, which is 4% of the total kids, the number doubled. There were 1,200 kids not unvaccinated. And so you have to be very specific and look for specific data about one vaccine and at one particular time point to compare apples to apples. But when half of the unvaccinated children are in the 4% of homeschool, it shows you a very clear association of a risk factor. And outbreaks of disease among homeschool children have happened in Louisiana and other states. There was an outbreak of varicella a few years ago at a homeschool field trip where an infant was on the field trip, and the parents wanted so bad for their child who had chickenpox to go on the field trip that they elected to send them anyway and have an outbreak. So we do have to be very careful and ask questions. And I think part of the dynamic will change, is my soapbox, when parents are held responsible for outbreaks. That $13 or $14 million bill in California, if the parents who were responsible for that outbreak were held responsible financially at the state level, or for the death of another child because of a vaccine-preventable disease, or if their insurance company says, you know what, your child gets measles and has to be hospitalized, we're not going to cover that hospitalization because that was a preventable disease that you chose not to. Those are the kind of factors that will push our society more toward vaccinating. Finances matter. And what we're seeing in the school systems now is kids not going to birthday parties because other kids are not vaccinated, or vice versa. And so there's beginning to be a discussion or combat between parents about vaccinate, non-vaccinate choices.
Well, I'm really happy there's pediatricians that are out there that are refusing to have kids come to their practice who don't vaccinate. I think that's such a great thing because, I mean, you just run such a risk with all your infants or all your immunocompromised kids getting these diseases that other children, just because their parents don't want to vaccinate them, the
other approach there is that if the children aren't fully vaccinated, they have to wait in the car until the time of their appointment. And that way you're not dismissing them from practice or ostracizing them in some way, but really they become a risk to your, or liability and risk to your patients who are vaccinated. You can't be vaccinated for medical reasons.
Right.
Are there some legislative efforts to tighten up the exemptions in Louisiana or California as far as, you have religious exemptions, or, then there's the whole broad category of other? Is there some?
So in, do you want to, I know.
California, I know, is they won't allow you to go to school at all if you don't vaccinate. So there's no exemptions anymore in California because of the outbreak they have now. I don't know about Louisiana.
So the question is about allowing non-medical exemptions, right? So we're all agreed there's a medical exemption period that's acceptable. Thinking about a kid who has cancer and they can't get an MMR because it's a live virus vaccine, or an immune deficiency, right? Those are medical exemptions, those are acceptable. In California, they basically, a couple of years ago, removed all non-medical exemptions from vaccination. So in a very tough legislative environment and state, they were able to remove non-medical exemptions. In Louisiana, we have talked about promoting this agenda. Nationally, the Academy of Pediatrics has begun to look at it. In several states, it's been introduced. It tends to bring up major discussions, and it's like people come out of the woodworks to fight against the removal of non-medical exemptions. And so we have elected, because we know who some of the players are in the state, and largely it's a homeschool population and other groups. I'm not trying to denigrate homeschool groups are perfectly fine. Is that there are some groups who are so strongly against it, and putting forward a proposal in law would give them a stage to get more support. So the risk is that we could lose more ground than we gain in the process. So that's right now kind of on hold. Yes.
You kind of alluded to this in your talk, but I've heard a lot of, especially Catholics, who say that vaccines are tested on aborted fetuses. I've heard the injected part, but so much tested on, and that's why, and it kind of goes back to the homeschooling groups too, that's why they refuse to get them.
Right.
But you kind of mentioned the Pope did put out a statement that said it's okay to get it, and that's something we can point them to, because
the Pope actually endorses vaccines,
right.
And it's really none of the, and I don't know 100% right now on how many are tested on the cells.
So the question goes back to, because I'm familiar with the Catholic bioethics literature, the question goes back to a few things. One is, were vaccines developed in cells from aborted fetuses, right? And does that mean that somehow the vaccine is, by extension, immoral or shouldn't be used because of that? And the bioethicists, the Vatican has not put out a definitive statement on it, right? The bioethicists, Catholic bioethicists that I've spoken with about it are very clear that, number one, vaccines are good. Number two, the use of aborted fetal cells was a happenstance of the time. There were not other cell types available. And most importantly, number three, there are no, using vaccines does not promote abortion in any way. That is, there are not more abortions happening just to produce vaccines, right? So that those three things together make a very strong bioethics argument that vaccines are acceptable. I know I'm Catholic. I know a lot of Catholics who are afraid that there are proteins or other components from aborted fetuses in the vaccines, and there's no scientific evidence of that. It's a fear, but without any validation. And then the third piece is that, or the next piece is that no major religion, Judaism, Christian religions, Islamic faiths, none of them prohibit vaccination, right? So if somebody says it's against my religion, then they might be the only one in their church. We're talking about.
I was just going to add on that those cell lines are only used in Hep A, rubella, and varicella and Zostavax. So otherwise, everything else is not grown in those lines.
Right. So we're only talking now really about live virus vaccines potentially being problematic, but there's no evidence that, number one, that's medically problematic or immunologically problematic, and number two, no ethical reason to consider problematic by most people's standards.
What do we do, because our president had a little bit of a push where he wanted to delay vaccines, and he was on the media always talking about it. And I have a lot of parents that come in that want to delay all these vaccines. I mean,
so they're Trump supporters?
No, in general. I mean, it's a man who's the president of the United States who stands in front of
that counting vaccine hesitancy article actually addresses this. There's no evidence to support delaying or extending out. There's been lots and lots of studies, and all the studies have been done on the way that we vaccinate, the traditional vaccine schedule that's out there, and that has been proven time and time again to be safe, to be the only one that's been accepted. There was a physician, a pediatric physician, who put out a book on how to delay vaccines, but he again says there's no scientific evidence to prove that my way is better. It's just a way for parents who don't want to vaccinate all at one time. But really, all the studies have been done on the proper way, and I really think that let's see if I can find it, that chart, this one, that shows you the number of proteins that are in the vaccines. I mean, nowadays, if you look in 2000, only 120 proteins are in all of those vaccines if you give them at one time, which is a lot less than the 1980s when you had less vaccines and there was more protein. So.
And in other parts of the world, they use different vaccine schedules because that's what they've studied in those parts of the world. And so it's part of the confusion for some parents is that there are different vaccine schedules in different countries. But it's only because that's the way they've been studied. And that's the way the FDA looks at vaccines, and that's the way that the ACIP and the CDC, who are actually meeting today in Atlanta, Dr. Burkini's there, look at vaccines. It's studied in the context of the other vaccines that are given at the same time point, and we know it's safe and efficacious at that time point. Yeah.
We're getting more moms who are coming in and delivering who are refusing the Hep B vaccine in the nursery, saying we're going to wait and get it, when we start the well baby shots in 2 months of age and stuff. And I know giving it in the nursery, essentially they end up getting 4 doses when 3 are what are needed. And I'm not sure where this push is coming from, other than that they don't want a shot for the baby and stuff. So, but we are seeing more of that.
Yeah, the Hep B and some of it is from. So this is where's the pushback? Why is there pushback on the Hep B vaccine at the time ground delivery before the baby goes home? And for a lot of parents, my sense is that it's the stress on the baby. It goes against sort of a holistic approach to although most of them don't breastfeed their babies within the first hour anyway, so you're kind of talking out both sides. So it's difficult, but yes, parents are afraid of the harm to their baby, which.
Well, it always makes me laugh because I'm like, you really think I'm going to do something to your child to harm them? Like, I don't think I would suggest something that would really harm your child, but.
And I think the statements of Hep B is when it's not permissible.
It is considered right. And if you refuse it, it gets you a social work consult. It's not a psych consult.
One other question, Maxie, do we know that it's actually the protein content that bothers the parents, or it's actually the number of vaccinations?
So
the shots.
One of the things that I get told is that there's so much in, like, so many shots at one time that have so much in them. So it's the amount that they're getting in when they get all the vaccine. Yes, it's the number correlated to the pain, but it's also you're getting so many vaccines. There's so much you're injecting to my child at one time, and that's a lot of what I've gotten too. And so, which always kind of blows my mind, but that's really where their thought is. And I've talked to somebody who thought that my child got so many vaccines at one time, and that load on their immune system caused an autoimmune disorder to lead them to get autism. And so I think it's really important that, yes, the pain, I can understand that. I mean, that's, you can help with ways that I showed, but when it comes to the protein load, I mean, I really feel like if you show them something like this, it's kind of hard for them to really counter that in any way.
My experience of what I get from pediatricians is most of it's the number of shots, not the number of vaccine components per se, because most parents are really not knowledgeable about the number of vaccine components. It's the shots that bother them. And that's why, on the research side, we have started to push the pharmaceutical companies who make vaccines to study combinations that that can work together, and that has helped some. But when we're talking about things like, if we can develop a chlamydia vaccine and a gonorrhea vaccine, and now we've got yellow fever outbreaks in South America, and what about a Zika virus vaccine and a dengue vaccine and an Ebola vaccine? All of these things there are hundreds of vaccines in development. some of them very different types of vaccines than what we've used. We use a chimpanzee adenovirus to make an Ebola vaccine. That's really a different immunologic, kind of approach that even I have to get comfortable with before I'm going to be real gung-ho on that one.
Do you know where they have the highest rate of vaccines, like which country?
Highest vaccination rates?
Mexico is one of them because they're mandatory vaccination. So it's mandatory to vaccinate all children. So I know Mexico actually has one of the highest.
I think some of the Scandinavian countries have traditionally very high rates, but they don't fall into the three categories of hesitancy. It's either fully vaccinated or not. All right, Dr. Steve Bienvenu, any comments?
Pill shots are painful. Just fix the flu problem, please. Fix the flu problem.
Okay.
Yeah, that certainly wears on pediatricians and residents every day. And we convince parents to get them every day, only to be notified by the nurse 10 minutes later. She doesn't want that. Okay, the mind against a mind convinced against its will is of the same opinion still. It's certainly illustrated daily, multiple times in the clinic. I know in Baton Rouge some years ago, local pediatricians presented a woman who'd lost her child previous year to flu, and she was in the media and all over the media, and I think they did much better in terms of preventing flu that ensuing year. But we don't do much of that. Of course, people don't want to talk about what happened to their child when they didn't get the vaccine. You don't hear anything about that.
Yeah, one of the things that we also do, I think it's important to notice that when we're talking about vaccines and the potential adverse consequences, we can't just say what could happen, right? So it's easy to sell an meningococcal vaccine, right? Show a picture of a kid, a teenager with no limbs. That's easy to sell that vaccine, right? But you haven't told them what is the likelihood of that happening. You have to have both pieces of information to make a good decision. The likelihood of that happening is 1 in a million or less, right? On the other side of the equation, look at HPV vaccine. We don't sell it well in terms of our recommendation being strong, and the perception is that, well, that's a sexually transmitted infection, and yet it can cause cancer. And those are true things that can happen, but what we don't tell them is the likelihood of those things happening. And the likelihood of those is much, much higher than the likelihood of the meningococcal disease, right? So if you're gonna play that priority game of how bad a disease can be, you have to give them the statistics on how likely the event is to happen. Okay? We have to do that. We have an obligation. All right, thank you, Dr. Davie.